My name is Joe Eisenberg. I'm the chair of the Department of Epidemiology. And my area, I'm an infectious disease epidemiologist interested in a variety of environmentally mediated infectious diseases and mostly focused on global health. And so this presentation, I'll be giving you a short overview of the department. If you want to go to the next slide, Elvira.
There we go.
And yeah, just for some logistics here, just asking you to, throughout the session, keep yourself muted at least, and you can keep your video on. Actually, that's always nice to see the people who are on and logged on. So as we had mentioned, this is going to be recorded, so if people have to drop out at any point, they can come back and listen to the recording. Also want to introduce Elvira, who will be part of this presentation. I'll be starting and Elvira taking over. She's the student service coordinator and will be around to answer a lot of your questions about the department and the program. And then I just want to mention that, so directly following our presentation, mine and Elvira, you'll be able to then connect with our current students. And then we'll have breakout sessions where you'll be able to have in smaller groups chat with and talk with faculty and students, as well as see some of the other admitted students in the program. So to get started, what I'd like to do is just really talk about Michigan public health, Michigan, and specifically our department, which is an old department. It has a long history. We pride ourselves as being interdisciplinary, specifically, and not just our department, but I think the school as a whole and the university as a whole prides itself with its interdisciplinary work. And you'll see that there's a lot of work and diverse interests and research and range of experiences that not just in our department, which is quite large, and we do have a quite diverse set, but also within the school and the university. And so what I'd like to do is, in this short presentation is just highlight those different research areas. And then Elvira will come in and talk more about the kinds of support we provide within our department and the school, as well as talk more specifically about courses and what we call our applied learning experiences, what used to be called a capstone. And finally talk a bit about DEI, which has become a very central part of our department and school and university as a whole. So to get started, I just want to highlight many of the ways in which we have this rich history. And this rich history is really, as you'll see, influences who we are right now. So in the early 1930s, we've got Pearl McKendrick, who was the chair of our epidemiology department and co-develops the first whooping cough vaccine. And as you'll see in this history, that we have a rich history in vaccine work that continues. In 1944 is the beginning of the National Sanitation Foundation, NSF. And if any of you have bought a water filter for your home, you are most likely have their seal of approval. They certify their existence. They certify most all water filters, home use water filters and more industrialized water filters. And they do a lot of certification on food products also. This is a great resource in our community. A lot of students don't actually realize it exists until later on, but they are very interested in and collaborate a lot with many of our faculty. And so they are still in existence. And 1955, so Thomas Francis Jr. is probably our most famous faculty member. He's done a lot of he did a lot of seminal work in influenza, but he was most famous for conducting the large scale vaccine trial for the Salk polio vaccine in 1955. And this is the big announcement that the newspaper announcement that this vaccine was safe. It was a huge, big, high profile study, and took a lot longer than it did to certify the quota vaccines that we're doing right now in a much lightning speed. It was a much more laborious task. So next slide. So we have a Tecumseh study, which started by Thomas Francis and continued for many years, was one of the seminal community-based studies conducted in the country to understand chronic disease and then also infectious disease transmission. And this study was a lot of the work of Dr. Armonto, which was highlighted in another slide here, did a lot of seminal work in understanding about household transmission, which is continued onto the studies that he's doing currently. In 1992, we've got this Michigan Public Health establishes a program for community-based participatory research. The people that started that are still here in the HBHE, and epidemiology is now really starting to embrace this community engagement activities that were seminal and were developed here at the University of Michigan, and we continue to use these kinds of principles in our studies and in our epidemiologic studies and in community work. So 1993, so Professor Arnold Monto conducts this study on effectiveness of vaccines. The influenza work again continues with not just Dr. Monto, but also Dr. Emily Martin. They now have grown into a much larger research program and are leaders right now in the COVID work that is being conducted throughout the country and internationally. And then next slide. So we also have a very strong genetics epidemiology program. That was started in 1996. Some of the faculty that started that are still here, and we've got a lot of new faculty in this area. So genetics is a major important area. In 1998, we have Sherman James starting the Center for Research on Ethnicity, Culture, and Health. It also was the impetus and start of our social epidemiology program, which we're very proud of and have a strong presence in. And then in 1999, we become one of the 23 centers from the CDC. This is kind of extends the work, that influenza work that Dr. Monto and Dr. Martin conduct here within Ann Arbor and also internationally. And then finally, we've got, we have in 2003, Dr. Masab developed FluMist, which has been a very big part of the arsenal in trying to fight and control influenza. That was developed, FluMist was developed by Masab. And then in 2011, we've got the University of Michigan Kidney Epidemiology and Cost Center, KEC, which is a huge program still going on. A lot of our students actually work and do some help conduct research within the KEC Center. And then lastly, I just want to mention that all the work that we've been doing in COVID, a lot of our faculty in epidemiology have been central. I mentioned Dr. Martin and Dr. Monto, central in the work both locally, regionally, and nationally. Dr. Monto is chairing the FDA committee that evaluates each of the vaccines before FDA approves them. And Dr. Martin is leading a lot of the activities among many other faculty like Dr. Merce Eisenberg helping the state work on controlling and mitigating coronavirus, COVID-19 transmission, as well as working at the university to try and manage and manage the pandemic within our university. So we have this rich history that continues, and just highlights a few of the students and some of their quotes. These are some of our current students. During the MPH program at Michigan Public Health, I started gaining awareness that my situation wasn't unique in the student athlete community. Doctors do not get to the root causes. From an early age, I was exposed to doctors, hospitals, and medical procedures due to my younger sister's diagnosis with sickle cell disease. As I continued to develop, I became confident that pursuing a career in epidemiology was the right path. A lot of these themes is the realization that a lot of us had that, when we think about health care and health sciences, we think about the clinical aspects of it. And often public health is not the first thing that comes to mind. Of course, COVID has changed that quite a bit. But I think there's a lot of stories here with respect to the realization of what public health can offer society. And then these are just some quotes from our faculty about their connection with public health. This is Dr. Laura Power. I've always been fascinated by infectious diseases and still remember reading the Hot Zone. My role as a medical director of infection prevention at Henry Ford Health Systems inspired me to study epidemiology, to understand the connection between health system, the community, and government public health. And Dr. Aubrey Gordon, as a kid, I was really interested in disease outbreaks. I remember watching Outbreak as a kid. As an undergraduate, I figured I'd be a physician. Following college, I ended up working on 2 different health-related projects, and these really got me interested in public health. Again, this theme about transitioning from thinking about being a doctor, thinking about doing more clinical work, to moving and realizing what public health has to offer. And finally, even our staff, which are, and this in this case, Hannah Sekaloff, our alum, there are 2 main things that kept me here at Michigan Public Health. The department within the School of Public Health are so great. Departments within the School of Public Health are so great and collaborative, and there are funding opportunities everywhere. And that, I think that's thematic, that we pride ourselves as being collaborative, we pride ourselves as being interdisciplinary, and we do have a lot of sort of funding opportunities and opportunities to get involved in many different aspects of public health that touch upon not just, again, our public health, but may touch upon the professional schools, may touch upon the School of Environment, may touch upon law or public policy, and all of those are available to you as students. So next slide. So this is just kind of highlighting the diverse faculty that we do have. This is our faculty, or actually not even all of our faculty, a subset of our faculty. We have a total of 40 faculty members in our department alone, and it spans all of these different disciplines. So we see that global health, for instance, is an increasingly important part of our department. We've got faculty working on infectious disease questions, working on chronic disease questions. Cancer is a big area now in global health, and we're working in Latin America, we're looking in Asia, we're working in Africa, Southeast Asia, and China. So we span across many different disciplines and geographically across many areas in our global health work. We've got many faculty interested in life course, from early life to midlife into aging questions. We've got faculty interested in working in cancer. We're well connected to the Cancer Center at the medical school. So there's lots of opportunity in this. And this is an area where there are many faculty doing epidemiology work in the School of Medicine. that students then connect to. Also, genetics, I mentioned, has always been a strength and continues to be a strength in our area and becoming more important in epidemiology. Hospital molecular, we are a unique program in that we have within our epidemiology department, we have people doing lab-based work. We've got virology work, virologists, we've got bacteriology, um, and we've got a lot of more looking at biomarkers and chronic disease questions conducted in the lab. And so people in the HME track, students in the HME track actually are in the lab learning how to work with, learning laboratory techniques. So it's unique to have that within an epidemiology department. I mentioned our social epi group, which is also quite strong. And the social epi people, 9 faculty, span many different areas, including infectious diseases, which is usually not represented in social epidemiology. Public health practice, we have our 2 faculties, but also connected to the different health departments, and our connections to the health departments have only increased with COVID, both at the local level and the state level. Systems and modeling, this is an area where we have, I think, a unique strength in the country with respect to our modeling expertise and the courses that we offer, both in infectious and in chronic disease. We've got a wide range of infectious disease activities that spans global and domestic, spans laboratory-based and field, and connected to more empiric statistical analysis as well as modeling. Many of you are in the general epidemiology track, which a lot of faculty are represented also, as well as in the occupational and environmental track. We have a lot of strength also in environmental epidemiology. I mentioned the influenza research, which is a growing area within our department. And then nutrition, which we have at a department of nutrition, but we do have people here doing nutrition epidemiology also. So you can see we have strength in a lot of areas. We have strength in a lot of areas because we have so many faculty. We have 40 faculty. And I just want to emphasize that this is not the universe. That, we've got the school, we've got professional schools in medicine, in pharmacy, in dentistry, in nursing. They're all walking distance from our School of Public Health, and they all have people working in epidemiology. So a lot of students connect both for research, internships, for their integrated learning experiences. They connect with faculty outside that are often joint faculty with us, but they could also be just doing basic epidemiology work that is relevant to your interests. So the last piece is just to emphasize that in addition to this, we've got a number of important key centers that in which a lot of the areas that I just mentioned occur. So we have the Center for Midlife Science. So they're really interested in that life course piece that I mentioned before. And they're really emphasizing that the midlife is really key to really understanding what happens as people age. Their exposures and experiences in the midlife becomes important. So Center for Midlife Science is an important piece. There's a multi-center study called SWAN, Survey of Women Across the Nation, that is the centerpiece for this center. We've got, and Dr. Svana Harlow directs that center. Dr. Betsy Foxman directs the Center for MacEpid, which is really a really nice center that integrates laboratory work, field work, and mathematical modeling in a nice integrative way. And so Dr. Foxman does a great job in engaging with students. There's journal clubs, there's seminars that occur. We've got the Center for Social Epidemiology and Population Health, co-directed by Dr. Belinda Needham and Dr. Brianna Mezuk. And there is, again, we've got incredible strength in social epidemiology, and there's a lot of cohesive building kinds of activities, both social and intellectual and academic, that that center does quite a bit. I mentioned our modeling, which is not technically a center right now. We did just launch an MS program in computational epidemiology and systems modeling, a big strength of ours, and it's kind of evolving as we speak with respect to the kinds of activities we do and attract in this area of modeling. So with that, I think I'll hand it over to Elvira to talk more specifically about our courses, about our support systems, and about our DEI program.
Thanks, Joe. Hi, everyone. As Joe mentioned, once again, my name is Elvira Rivera, and I am the Student Services Coordinator for the department. I am part of a fantastic Student Services team that is all very excited to potentially work with you in the fall. Right now, I'm just going to give you a very brief overview of the curriculum that's going to be established for you if you decide to choose Michigan. So every student that is in our program will have to take a set number of classes. So for example, we do have a public health, there's public health classes that's core, that's part of our curriculum that you have to take. So it's 11 credits spread out over your time in the program, roughly 2 years. It's a 60 credit program for majority of you all, and that means 11 credits spread out for the upcoming 2 years. And we make sure for those public health courses that you're exposed to every single department. I mean, although I love epidemiology, it's near and dear to my heart. I tend to think we're the best, but there's, health, behavioral health education, health management and policy, environmental health science. This way, through these public health courses, you get a little sneak peek of a little bit of everybody. You get a well-rounded education with these public health courses. And then everybody will be taking EPID 600 along with a few, depending on what track you are, you'll be taking either 2 or 3 biostat courses in your first semester fall, your first semester winter, and then your second semester fall. And then for those who are in, well, as you know, we have different tracks, and with different tracks comes with a little bit of tweaked specialized classes specifically geared for your track. For example, the global health epidemiology, our occupational environmental epidemiology, and hospital molecular epidemiology all have additional classes to take that make you more specialized in the field. So when you go off and graduate, you've got that knowledge in your backpack ready to go and to show off like how awesome you are. And then our general epidemiology track, there are 2 options, a 60 credit and a 42 credit. And it's not, for that track, you don't particularly have additional classes to take. You're not as specialized because you're more general. You can tweak it and take electives where you see fits your background the best. So we have okay, so for your experience, you have practice-based and applied-based learning. So, and that's going to be incorporated throughout your coursework, but more specifically for our GE, GHE, and OE students, that's geared toward EPID 603. It's a professional development seminar that you'll take your first semester winter and your second year fall. For our EPID students, for our HME students, hospital molecular students, this class is linked to EPID 565 that you'll be taking your entire time in the program. Then after your first year in the program, you will have a summer internship. God's willing, COVID is under control and you can go out, but right now, these last 2 summers, it's been virtual, and our students have had a wonderful opportunity to still participate in internships virtually. So this internship takes place between years 1 and 2 in the summers. An internship is required for our general EPID, global health epidemiology, and occupational and environmental epidemiology. To our HME students, our hospital and molecular epidemiology, it is optional. But if you want to pursue an internship over the summer, we're never going to stop you. We want you to get that experience that you want. And for our summer internship, it's about 8 weeks long with about 318 hours of work dedicated over your summer. Then we have the applied practice experience. We call it the APEX. There's one thing about U of M, we're all about our acronyms, so APEX. And this basically promotes student professionalization by exposing you all to real world public health activities, settings, and practitioners. It gives you all an opportunity to practice the skills that you've learned throughout your time in the program in the classroom based on your own career interests and professional goals. And with that, you're producing 2 products or deliverables that cover 5 competencies. And then lastly, we have our ILE, the Integrative Learning Experience, also known or formerly known as your capstone research paper. And these are connected to a couple of classes. So for our GHE, GE, and OE students, this is related to EPID 604 and EPID 530. And then for our HME students, this is linked to your EPID 565. And this is completed during your second year in the program. So we have, within the university, it is our goal to make sure you have the best possible experience in the program. And there are so many levels in which you're going to experience support. So not only at a department level, not only are you having me constantly with you in your life until you graduate and hopefully and beyond, but you also have Dominique Person, who is our internship and applied learning coordinator. You have your faculty track leader and our advisor. And then we have some school resources that are available to you. So not only do you have the staff and faculty of the department, but there are also student groups affiliated with our department. So in this case, for our MPH students, it's our ESO, Epidemiology Student Organization, and then for our doctoral students, EDSO, Epidemiology Doctoral Student Organization. We also have an EPID Wellness and Inclusion Advocate, Andrea Hill, she's amazing, along with our CAPS embedded counselor, Megan Narula. And CAPS stands for Psychological Services for you all. And then for those interested or in our GHE track, we have the Office of Global Public Health. And then we, for everybody, we have the Career Development Office. Crystal Forbes and Sheila Sands are the most amazing people in the world. They are fantastic. And then of course we have our Public Health Practice Office that'll be available for you. And then university services, this one little thing, okay. We have for our international students, we have our English Language Institute. For within the school, we have a public health writing lab. That's basically Chris and Harold. And then for stats resources, we have instructional aid and tutoring in that area. And then of course, lastly, we have Sweetland Writing Center for all your writing needs. So as you can see there, we try to set you up for success on all areas, not only department, the school, and university-wide. So our DEI, diversity, equity, and inclusion in the epidemiology department. The goal of our DEI and epidemiology is to integrate everything we do. It's to collaborate with different departments and committees within the school. And turn this off. And we want to make sure that everyone has what they need to succeed, regardless of background, lived experience, beliefs. We want to foster an atmosphere of trust and respect. And there's multiple ways in which you can get involved. We currently have a Rackham Faculty Allies Diversity Grant. We do have our own department DEI committee. There's a school-wide DEI committee, and then there are DEI grants in which people can apply for if you want to see something implemented in that upcoming year. There's my mouse. There we go. So let's see, how are we on time? Actually, I think we're going to skip this portion and get ready for our upcoming panels. So on that note, I would love to thank you all for attending. We really hope that we see you in the fall. If you have any questions at all, please feel free to reach out to the Student Services team. There's me, there's my contact info. Feel free to reach out to me anytime. Just know with us, after Admitted Student Day, my email tends to explode. Just give me a little bit, I will get to you. We have Dominique Person, who is our internship coordinator. So any questions regarding that, please feel free to reach out to her. She's amazing. And then of course, Nancy Francis, who I'm sure you've all been working with her throughout your whole admission process, application process. If you have any questions about that, please feel free to reach out to her. But we are all here for you and we're excited. So let me end my slide. Hold on 1 second. Let me stop sharing. Okay, there's everybody. Hello. Would like to take this moment to introduce one of our EPID faculty, Jen Smith. She is our admissions chair. So Jen, I take it away for you.
Thanks, Elvira, and thanks, Joe. That was a really great presentation. Hi, everybody. I'm so excited to see you all here. I'm an associate professor in EPID, and I also do research in genetics and epigenetics of chronic disease and cognition. So that's why I have my genetics background up today. I'm also active in social epi and health disparities. And as Elvira mentioned, I'm the chair of our EPID admissions program. So I feel like I kind of know you all just a little bit already. So it's great to see you, and we can't wait to see you in person here at Michigan. I'm going to be moderating today the alumni showcase and our current student showcase. So without further ado, I think we'll just get started. And we're going to spend some time chatting with 4 fantastic alumni. So I'm going to ask each of the alumni to introduce themselves, state the EPID track that they were in the year they graduated, and then to spend about 3 to 4 minutes each talking about what they're doing now. And then when they're all done with their presentations, we can take some questions from the audience. So Caleb Ward, do you want to get us started?
Yeah, thanks. Pleasure to be here. My name's Caleb Ward. I was in the global health epidemiology track and graduated last year, although it feels like a lot longer than that. And right now I am an epidemiologist for the CDC Foundation placed at the Detroit Health Department. So my entire job is dealing with COVID data in Detroit. And yeah, I really enjoy it.
Okay, great. Do you want to just tell us a little bit more about, sort of the things you do on a day-to-day basis, and maybe, how Michigan has helped you achieve your career goals?
Yeah, so as I said, we handle all the COVID data. So a lot of it is reporting. So different reports go out to different stakeholders, both internally and externally at the health department. So we manage the data dashboards. If you look at those for different, we manage the Detroit one, but every county and every state has their own. We also send reports out to various people across the city, whether that's cases related to education, addresses to the fire department and police. The mayor has his own dashboard, get tests, confirm that COVID deaths are actually COVID deaths, confirm positive cases, confirmed versus probable, and everything like that. And yeah, Michigan. So I applied to this job through the Michigan job portal. And I think that was a plus for me. And also classes and professors really prepared me for my day-to-day, whether that's the programs I use, kind of the writing experience I got at Michigan. I'd say they really prepared me well.
Great, thank you so much. Next, Joel, would you like to tell us a little bit about yourself too?
Yeah, good morning. Hi, everyone. My name is Joel, and I use he, his pronouns. I am Navajo, originally from Shiprock, New Mexico, on the Navajo Reservation, which is in the Four Corners area. I graduated from University of Michigan School of Public Health in 2018 with an MPH in hospital and molecular epidemiology. And I also received a graduate certificate in healthcare infection prevention and control, which was another great program at Michigan. Currently, I work as a data manager and analyst with the life course Epidemiology of Adiposity and Diabetes Center at the University of Colorado Anschutz Medical Campus. So I am calling in from Colorado. I oversee data management and analysis for Tribal Turning Point, which is an ongoing randomized clinical trial that aims to prevent obesity and type 2 diabetes in American Indian youth through diet and physical activity interventions. And I also conduct longitudinal data analysis for the Environmental Influences on Child Health Outcomes Project, or ECHO, and it's a longitudinal cohort study that aims to investigate environmental exposures on child health and development.
Great, thank you so much, Joel. Lisa, do you want to tell us about yourself, please?
Sure, thanks. Hi, everyone. I'm Lisa Zook. I am the Director of Research and Impact at Informed International. And so I graduated from Michigan in 2011, actually. So I think I'm the old person here. So I graduated from the general epidemiology track. And at the time, we had an international health program, which it sounds like has turned into the global health program, which is great to hear. So I'm currently based in Seattle. After graduating, I started working for World Vision International. And so I did monitoring and evaluation for their maternal newborn child health programming and also their early childhood development programming. And that was overseeing the research and the data associated with their programs in about 25 countries throughout Southeast Asia and Sub-Saharan Africa. And then did a few years with Save the Children, again in their health and education programming, and then started a monitoring and evaluation firm that focuses on international development monitoring and evaluation, which is called Informed International. And so we've been doing that for about 4 years, working with international development programs in Asia and Africa.
Great, thank you so much. Jacqueline, last but not least, do you want to tell us about yourself?
Hi, everyone. My name is Jacqueline Cardoza. I graduated in 2018, and I did the occupational and environmental epidemiology track along with the risk science and human health certificate. And I currently am working at FEMA on the National Incident Management Assistant team. So I'm with the team that goes out on any kind of disaster. Currently, right now, I'm working on the Southwest Border Mission, the humanitarian crisis. But previously, I was actually working on the COVID-19 aspect. As a planner, I actually wrote the plan on how the community vaccination centers across the country are working. So that was a really cool experience. And even before that, the University of Michigan really got me interested in disasters in general. I was able to go with the practice office and worked in USVI. With a CDC representative to understand how epidemiology could help out after disasters. So definitely wouldn't be here without my education and the experiences I had at UMich. So thank you.
Thank you so much. So we have about 15 minutes for questions. And so if you'd like to ask a question to our alumni, you can go ahead and just unmute yourself and introduce yourself and ask the question. Or if you're more comfortable, you can send the message in a chat. So does anybody have a question right off the bat? Okay, I'll go ahead and get us started, and then the students will all be ready with their questions for the alumni. What are some things that you wish you knew, or what is one thing you wish you knew when you were starting your MPH? That's a question that I really like. So does any of our alumni want to answer that question? And then I see some rolling in for the chat. So we'll have some more for you after that. If one of the alumni wants to answer, you can just raise your hand and I'll call on you and you can get going.
I can start. So Jacqueline briefly mentioned this, but her getting into disaster relief from an epidemiology standpoint, I was also not aware of that when I started school, and I also participated in FAST, which was the organization she was talking about, which is an incredible part of U of M SPH. And so just the diversity of fields. So public health is so vast, and you have no idea the amount of opportunities. And U of M really does showcase a lot of that. So when I started, I really wanted to kind of get involved widely as much as I could, but then even now I'm still learning about new things. And so that's the one thing I wish I knew when I started.
Great, thank you. Are there any other alumni who'd like to chime in with a tip or trick? Okay.
Yeah. Oh, sorry.
No, please, go ahead.
Yeah, really quickly. What I would you mentioned tips, so I would recommend, at least this was my approach with going into Michigan. The program at least was identify 3 goals that I wanted from the program. One of which was to learn coding. 2, and kind of along with coding, just technical skill set in general. Goal 2 was to become engaged with the interdisciplinary teams, and SPH is a great place to do that. And then goal 3 was actually a publication, and I was able to say that I did all 3. So that was really helpful.
Those are really great comments. Thank you so much. Okay, so we have some great questions in the chat now from the students. There is a question from Swathi who asked, how is the process of finding a job right after graduation? So if 1 or 2 alumni can kind of comment a little bit on that, that would be fantastic.
Sure, I can start us off. For me, I really leveraged my connections with the FAST team. I was able to really work together with Dana Thomas, who was really, really exceptional to bridging the gap between where I wanted to be within the field and how to get there. I realized very quickly that having those connections and being able to utilize them, get really great letters of recommendations, having those connections really allowed me to land a job at CDC as an ORISE fellow. And for that, I definitely would say that, like, when I was looking at jobs, I was really trying to land a job. I really wasn't looking at a fellowship, but it did open up the pathway for me to get this job here at FEMA. So definitely look at fellowships as an opportunity, as a stepping stone to get to where you want to be.
Great. Other people want to comment on that?
I'll just add that it was my internship at Michigan that led to my first job after grad school. So yeah, I did an internship with a hospital based in Malawi, and I think that was a connection from the School of Public Health, and then that connection kind of led to an internship with World Vision, which then turned into careers and lots of other connections.
Yeah, thanks for bringing that up, Lisa, about the internship, because we also had a question from Audrey who said, I'm interested in learning about how your internship experience contributed to your eventual career path. And it sounded like that really played a big role for you, Lisa. Do other alumni have commentary on their internships and how that helped inform their choices?
Yeah, sure. So me being on the HME track, I'm actually really interested in infectious agent associated cancers. And so for my internship experience, I wanted something that revolved around cancer. So I pursued an internship with CESP, which is the Cancer Education and Special Populations, or Cancer Epidemiology, Education and Special Populations. And that was external to Michigan, but connected me, oddly enough, with a native physician at Michigan, whom I worked with closely on breast cancer epidemiology among Native women. And that's really aligns with a lot of my work in terms of my career goals. And I actually continue to collaborate with her today. And I'm actually also excited to announce that our manuscript was published this week. So it's also exciting. So.
Great, thank you so much. I think I popped in and out of the internet at my house. So if I cut off, please forgive me. So thank you, Joel. That was great. Does anyone else want to comment on the internship piece?
Yeah, I would just like to jump in and say that the career development office is really great with putting out information about both internships and jobs. I'm a little biased since I worked there when I was at UMich, but it was a really great opportunity to see what was coming in, and there's a lot of alumni, so there's a lot of opportunity to make those network of connections. And I would also say that don't be afraid to kind of push the boundaries on what you think is a public health internship. I actually worked at an emergency management office for my internship, and that truly is what directed my interest in emergency management, and seeing how, especially now with COVID-19, how much we're working together with emergency managers and local public health officials, definitely start thinking about how your direction could transcend different disciplines as well.
Great, thank you so much. There's a couple of different questions coming in. One is, I know some of you touched on this in your intro statement, but if you haven't already said them, are there specific aspects of the U of M EPID program that really helped you sort of move forward in your careers that you haven't already touched on that you want students to know about?
I'll say that the statistics and analysis and kind of the rigor with which, at least I felt like I graduated with very specific skills that I could offer, and that was very marketable when I first came out. And in fact, I'm still using all of those biostats classes that I took. And I think that definitely set me apart from other kind of MPH graduates from other programs.
Yeah, for me, one thing that I loved was the amount of practical experience that I got while at the program. So whether that be working as a research assistant for research projects at the school, absolutely loved my internship. And then being part of FAST, the Public Health Action Support Team, just had all those experiences to talk about in interviews and gaining that real world coding skills, data analysis, project management, other things like that. Really valuable.
Great, thank you for touching on the research piece here at Michigan, Caleb. I feel like that's a real strength that we have. For people who haven't talked about it yet already, did you have what Janet wants to know, how were your research experiences here at Michigan? And if you haven't already sort of talked about those pieces, are there any other, sort of research related items that you wanted to mention to current students coming in?
Yeah, one of my one of the HME faculty members. Well, first of all, the HME faculty were very supportive, and one of the faculty, well, my advisor would actually forward me opportunities that were circulating around on campus, and one just happened to be from the Department of Neurology, and I ended up working on multiple sclerosis research with a neurologist on campus, and that was really interesting to work in. I wasn't necessarily in the lab, but we were doing a lot of lab work, and I was assisting with the analysis and such, and so that was really neat to be able to see epidemiology applied in a variety of different settings, from clinical to prevention, et cetera. And it was a lot of fun. I thoroughly enjoyed it. But then that being said, that also led me to work in the Department of Radiology, and now I'm working in the Department of Peds. So again, it's interesting to work with a variety of different populations and really improve population health.
Okay, great. Did anyone else want to talk about research related experiences? Caleb?
Yeah, I can add to that. And another strength of Michigan is that since it's such a big school and you have so many opportunities open to you, you are not siloed in your specific track or program. So for my on-campus job, I worked with the Martin Lab doing flu research. And it was cool to see her actually advising Governor Whitmer, and like seeing her on the press conference, a couple of our professors be like, I know you. And then I did my internship and research with a professor from the medical school. So Michigan loves research and opportunities abound. And if, you love your current program because that's why you're in it, but if you're interested in other things, definitely reach out to people and everyone's happy to help.
Yeah, that's great. Great advice. Thank you. couple of other questions. One from Rebecca. For people who have graduated in the past couple of years, what are your long-term career goals? And maybe a related question from Janet. What made you decide to sort of find a job after graduation instead of pursuing a higher degree? So sort of like, what's your trajectory and that decision making around that? They're asking the tough ones.
I would say I was pretty fortunate enough to land kind of my dream job right out of grad school. Getting to work at the CDC was always kind of my dream. Even if it was just at a fellowship level, I felt like I had the interworkings of CDC. And then once I started realizing I was more interested in doing things kind of on the ground instead of doing that technical assistance work, I switched over to FEMA, which I now can fortunately say this is now my second time I've landed my dream job. But for the long-term aspects, as I keep climbing into these things I'm really passionate about, I realized that there is so much more that I can really do. And like I mentioned before, like leveraging the connections, I feel like there's nowhere I can't go, which is kind of a really, really powerful feeling to have. And then also having the technical skills, as other alumni have said, that UMich has given us, that I feel like not only I can understand the technical papers and the research papers and peer-reviewed papers, but I can go apply it on the ground to the real-world problems. So I don't really know what's in store for me in the long run, but I feel pretty confident that I have the skill sets to achieve it.
Great, thank you. Other alumni want to make some commentary on your sort of trajectory and how you made those decisions?
Yeah, sure. I'd say for me, I'm my passion is again to work in infectious agent associated cancers, specifically among Native populations, and a part of that work requires community partnerships, and that's kind of what I'm doing at this point, which is building those partnerships, building that trust to be able to engage with the populations, like engage with my own communities, right? And do the work that is most meaningful and most helpful for them. So with respect to kind of next steps, I certainly see myself in a doctoral program in epidemiology, whether or not that's in cancer epi or just behavioral health epi or what that, I'm not completely sure what that looks like exactly. But I certainly foresee a doctoral program in the coming years.
Great. I mean, I think one thing that you both have really highlighted is that, the master's program here can actually prepare you for a lot of different trajectories and tracks, whether it's in research or practical experience, and that you don't always have to take it to the final piece if the PhD is your goal immediately. Like you can go out and get some experience and learn some things. So I really appreciate that commentary. I guess we have 2 minutes left, and maybe I'll throw one last question out to you. Kushbu has asked, do you have any advice for reaching out for research assistantships or internships? When should we get started on that in your experience? And if you have any, sort of general advice in that area. I think a few things have been thrown out already, but if there's anything else you wanted to comment on.
I'll jump in and just say that I don't think there's any harm in starting relationships early, but one thing that I have learned in this field is that often there's a lot of kind of talking, discussing, waiting, and then all of a sudden, something gets funded or all the pieces come together and magically things move forward. And so it's nice to kind of be on someone's radar for when that happens, and then you can jump in and become a research fellow or an intern or something. And so yeah, I think forming those relationships over time is really beneficial.
Do any other alumni have any comments to add to that?
Yeah, I can say, yeah, there's nothing is too early. Completely agree. And if you don't find anything specifically on like a job board, always feel free to reach out to professors individually. You can look. The SPH website is pretty great at splitting up professors by areas of interests, and you can also read their bio and what they're working on. And so if something really stands out to you, ask them if they have a project for you to work on. Maybe they don't right now, but then, as Lisa said, again, on their radar for something if it comes up in the future.
Yeah, thank you. I would have to sort of echo all of that and say also to, if you don't make contact on your first try, to also not take it too personally and try again, because people do miss emails. So I would say, you know, give it a couple times, and then like you said, build those relationships over time, because you never know when something's going to open up, and you know, one professor might be able to refer you to somebody else if they don't have something. I think that's great advice. So I really want to thank our alumni for being here today and sharing your experiences with these students. It was really fantastic, and we really appreciate you taking the time to come and give back. So thank you very much. And I think unless Elvira or Nancy have any piece to say here, I'll just go ahead and get started with the current student panel. Okay, great. We now have 4 students from 4 different tracks in EPID who are going to spend about 3 or 4 minutes sort of doing the similar thing that the alumni did. So they're going to introduce themselves and the track that they're in EPID. And they're going to talk a little bit about why they chose Michigan and what research or other activities they're doing here. So I think we'll go ahead and get started. First, I want to open it up to Samita. If you would go ahead and get us rolling, that would be great.
Yeah, thank you, Jen. Hi guys, my name is Samita. I'm in the global epidemiology track. I'm a second year. And so why I chose Michigan, before even applying, I actually had the opportunity to visit campus. I'm from Ann Arbor, so that was helpful. But it was really, I spoke to a couple faculty members, and that kind of helped me make my decision, because I just love the culture here. They were very helpful and very informative on what the program was about. The wide range of research opportunities was really attractive. And then also the large alumni network gave me hope that I will find a job after, which was one of my stressors in joining a grad school program. And then in terms of research, I became a part of a COVID-19 surveillance project last summer, so between my first and second year. It was very, very relevant to the time, and I've been a part of it since. From an internship, it became a job. And now I'm doing research through that with the data from that project. I'm looking at associations between symptom severity and social stigma experienced by recovered COVID-19 patients in Michigan. And I'm really enjoying it because I've been part of this project since the birth of it. And it really got me into infectious disease epidemiology too. Thank you.
Great, thank you so much, Samita. Really appreciate that. Shannon, do you want to go next, please?
Yeah, I can go. Yeah, my name is Shannon, and I am a first year occupational and environmental epidemiology student, so the OEE track. And one reason I chose Michigan, like Samita talked about, is definitely like, I think the faculty and student environment here is very supportive and passionate. But also I felt like the school takes a very like interdisciplinary approach. For example, with the OEE program, being able to pursue both my interest in epidemiology and environmental health. The school also offers a lot of like different opportunities to get involved across schools. So one thing I'm doing is the Healthy Cities Certificate, which is across the public health school, public policy, and the School of Urban Planning. So I think just like being able to get into opportunities where I can work with people from different backgrounds was really exciting to me at Michigan. And as far as research interests go, I am interested in kind of the intersection of social and environmental epidemiology. So looking at like the built environment and urban health and health inequities. I'm currently working with Dr. O'Neill, and we are looking at the food environment in Mexico City and the impact that has on diet quality and health outcomes among pregnant women in that population, which has been a really cool experience so far. So yeah, that's a little bit about me and my background.
Great, thank you. That was awesome. Kaylee, do you want to go ahead next?
Yeah, sure. My name is Kaylee Rumpel. I am a second year hospital and molecular epidemiology student in the MPH program. Why I chose Michigan. Honestly, I think it had a lot to do with just the different scholarship offers I was given at different schools. Also, this is my home state, so I knew I loved Ann Arbor, and I knew a lot about the campus and things like that. Additionally, they have a lot of great avenues, kind of like Shannon was saying, to really, really get good training in a variety of fields. So for example, those certificate programs and things like that are very unique to Michigan, which I really liked, as well as the faculty and staff were incredibly helpful during the admissions process. And all the faculty that I reached out to, I know there was a question about, what should you do about research? I reached out about research like a year almost before, and it didn't hurt me at all. The two jobs that I got, one with Dr. Smith and the other at the medical school, were from those connections that I made while I was still an undergrad. So it is never too early, and that was really beneficial to me as well, to know coming in that I had research set up and a job that I was interested in, and that kind of was really worth my while as well. The EPID track, I already said I'm in the hospital molecular epi track, which is a little different from the normal epidemiology track. So if you're thinking about that and have any specific questions, I can help. And then the research I'm doing now, I'm looking at influenza evolution in response to vaccine administration. So how well someone is protected against influenza after multiple vaccines or different types of vaccinations. But right now it's all shifted to coronavirus because like the flu is no more this year. So I'm doing a lot of COVID sequencing, COVID evolutionary work and things like that.
Thank you, Kaylee. I think our fourth student is running just a bit behind, so we'll go ahead and move to the question and answer piece. And if she is able to make it, then we'll include her too. So I'll go ahead and start with my favorite question. I don't know if the students our current students were signed on at the time I asked this to alumni, but what is one or two things that you wish you knew when you were starting your MPH that you would give as advice to these sort of incoming students? Do any of you have some sage advice?
Well, I definitely wish I was more well-versed in Zoom. I think we all were. But yeah, you can't really plan for a global pandemic. But I guess what I would say is I thought that an MPH was this big, scary thing, and it was going to be so difficult, and it was going to be cutthroat, and it was going to be, just this big, massive undertaking. And it is. It's a lot of work, and you have to work hard, and you have to make sure you're doing your things. But it's not as scary as you think it's gonna be. And there are a lot of people at Michigan that can help you through any experiences that you're having throughout the program. I think if I would have been able to tell myself that, I would have had a little less stress about, the first semester and starting school and things like that.
Thanks, Kaylee. And I want to say, Shannon and Savita, I'm going to give you a chance to answer, but if the admitted students have questions for our current students, you can start chatting them to me as well. Samita or Shannon, do you want to talk a little bit about something that you wish you knew before you came or that you've sort of learned since?
Yeah, I think adding to what Kaylee said, just kind of getting comfortable with approaching professors and second year students or even alumni was something that I just, I guess I didn't really have on my radar. I was so focused on the academics of it, but the networking is a big part of your 2 years. That's how I got my internship, which turned into my job. So, um, just it's okay to reach out. People, the community at Michigan is so helpful, and they're very connected. So even if the person you approach doesn't have anything for you, chances are they probably know someone that does. And you can just explore your interests as much as you want, which is really cool. So I guess just, yeah, like being comfortable with, kind of shooting out emails, even if you don't know the person, or going up to them or having a side conversation about, I guess over Zoom now, but over like guest faculty that come to your classes. I mean, they really enjoy talking to students and you will just get more information about your interests too.
Great. Shannon, did you have something to add or?
Yeah, I think just kind of going along with that, I think just realizing that your MPH and your education here is really like what you make it. And like, it doesn't have to look like, what you thought previously or how someone else is doing it. It's really can be tailored to like what your interests are. And so if you're still exploring a lot of different areas that you're interested in, to like really take advantage of like looking into those different opportunities and making different connections. Like you can do different things for your internship, your ILE, your Apex job, just like a lot of different ways. I think I went in thinking, it was maybe more like, okay, we're all doing this, this, and this, but like it really is what you make of it. And you can really focus in a specific area, or you can like expand your knowledge in other areas that you haven't considered previously. And so I just like, encourage you to like take advantage of like all the different opportunities and connections that you have like while you're here, and just like I think like what Samita said too, I think I can tend to get focused on just the academics, but the networking and all the other opportunities are like a huge part of your degree. And so definitely take advantage of that.
Great, thank you. The first question that came in, I really love this question. It's from Jessica. She said, are any of you first generation students? If yes, how have you felt about navigating grad school? And do you feel like Michigan helped you navigate it? And before any of you answer, I will just say that I was a first gen grad student, and I came to Michigan in 2003 to 2005, and I've been here ever since. I did my master's, I did my PhD, and now I'm faculty. And I won't spend a lot of time talking about that, but I think like what that did show me is that Michigan really does value the fact that people come from very different backgrounds. And even coming from that background, I was able to achieve a lot of things. So for me personally, I feel really connected to that question. But Samita, Kaylee, or Shannon, do you have any feedback on that piece too?
I'm a first generation student. I'm not sure if Shannon or Samita are. And I'll just say, if you're coming here for a master's, you already did relatively well at college. And it's very similar to like the, an undergrad. Like if you did well there, I would say you're going to do well here. I don't think that there's been any sort of things that have made me underprepared as a first generation student here. But what I'll just add is Michigan has so many. I came from Michigan State, and like not trash talking Michigan State at all, but Michigan has so much more just outlets for anything that you need help with, whether it be mental health or you want to join a group that is interested in reading about papers about squirrels. Like there's anything on this campus that you need. So like if you are struggling with something or need help navigating something, like if you just reach out to Elvira or Nancy or really any faculty, they will point you in the right direction of some path at Michigan that is going to help you navigate any issues that you're having being a first generation student. There's also first generation like clubs and organizations here. So it's really helpful in that sense.
Thanks, Kelly. Shannon or Savita, I don't know if you have anything to add, or should we move to the next question? Okay. Yeah, great questions coming in the chat. I'm gonna go with, can you talk about, sort of in general, a question from Manan. What have been some of your favorite experiences in the program, and what are some of the challenges that you faced, and how did the program support help you in sort of overcoming those challenges? So like a multifaceted question.
I can answer first. So in terms of favorite experiences, I think that I really like, Shannon kind of talked about this earlier, is that we can take classes from other parts of school, which is really cool. And so you're not just, I mean, you have to take your core epi classes, the ones that are required for graduation, but you also have the option to take electives from in nutrition or policy, or so you can really explore different aspects of public health, and that can count towards even like certificates, and you can add those to your degree. So it's really, I like the options of like diverse classes you can take and really explore your options in public health. And challenges, well, we did go through the pandemic when it started, so I would have to say that was the biggest challenge. I'm a global epi student, so usually global epi students do a international internship between their first and second year, and that was canceled like a week before we were supposed to basically like get our tickets and things. So my biggest challenge was just kind of navigating through that, finding a new internship within like a month of summer starting. But I guess a more relatable one would be, I don't know, it's kind of hard because even if there were challenges with academics, just hard things at school, but then there's tutoring available if you want it or if you need it. You can also reach out and do study groups to, in your classes. Professors usually offer like on Canvas, we have like a little link you can go to and just create your own study group with whoever you want or with random people. So that wasn't really, it was challenging at times, but usually there was resources that you can go to that people will really help you. And then if that is an option for you, you can always reach out to people like Elvira, and they'll help you navigate through other resources that in a speech that you might not know. They'll get you the help you need. So I think COVID kind of took over possible challenges because it was just trying to get back into like school, but it was online, and how that's going to happen. But even other challenges just with school, you more than likely you're going to get a person that'll help you out with it.
Thank you. Shannon or Kaylee?
Yeah, I think just kind of going off of that as well. Like, I think for me, being a first year student starting grad school online was definitely a challenge and not what I was expecting. But I felt like the school did like a really good job of it as still like in person, as far as like trying to meet and other students through like orientation and breakout rooms, and I was still able to make those connections and form those study groups for those more challenging classes, which was really helpful to still feel connected and not just like totally like in your little bubble on the computer. And I just feel like, there's just a wealth of resources. Sometimes it's kind of overwhelming to even like know what resources are available. And I feel like Elvira has been really helpful. Sometimes I just reach out to her to connect me to other people to figure out where I need to go for help. because that is there. It's just you have to find it sometimes. So yeah, I feel like the school and all the professors and faculty have been very, I'd say like flexible and adaptable to this kind of new environment with our coursework, and have really worked with us to make it manageable when everything is online. And I guess the other part of that question was favorite experiences. I mean, as a first year, I haven't really, I felt like been able to do some of the bigger experiences yet. Like I'm really looking forward to whatever my internship may be, not sure yet, but I have been able to get involved with research, which I really enjoyed, like meeting with different faculty and kind of seeing that process more and from a public health perspective. Also, yeah, taking classes like electives that are outside of EPID too have been like really fun to see some of the different frameworks and perspectives out there. I took an urban health class, which I really recommend with Dr. Medipana. That was one of my favorite classes so far. So yeah, that's been my experience, but I think the challenges that inherently come with any graduate program, I feel like the School of Public Health here has been really helpful in working with students to kind of overcome whatever things are, whatever barriers are in your way.
Yeah, and I can add to that just very quickly. My favorite experience, I think it's just been multiple experiences of Michigan has facilitated me understanding that I can do this. Like you can be a public health professional and you're going to be successful out there in the world. You're not going to be like a chicken with your head cut off. So that's been really nice and fulfilling. The biggest challenge obviously is COVID, but what I was going to say, just to kind of like make something like say something different is I really struggled with picking what I wanted to like really focus on doing with my life. I liked a lot of different facets of public health, and there was like specifically like I liked a lot of wet lab stuff and I liked a lot of like in coding, writing, dry lab stuff. So through my mentorships and classes and things, I was able to kind of figure out exactly which route I wanted to head. And that was really beneficial that I wasn't navigating that alone. So with that challenge, like the program really helped me figure out exactly what I wanted to do.
Thank you guys so much. I also see that we had our other student has arrived, Daisy Okpa. I think you're a current student. Hi. Do you want to just take a minute to introduce yourself, tell our admitted students what track you're in, and just a little bit about your experience here at Michigan?
Yeah. Hi, everyone. My name is Daisy. I'm a second year student in the epidemiology department, and I am also working towards a certificate in health informatics. For my capstone, I am looking at whether a racial concordance between physician and patient has better or worse outcomes for mothers during pregnancy. So that has been really exciting for me I create a survey for that and have currently in the process of analyzing the results that I have received. Here at Michigan, I'm a part of ESO, which is the Epidemiology Student Organization, and I'm also a part of the Michigan Running Club. I was a sprinter in high school and I wanted to keep doing that. So that was a way for me to still have track a part of my life. Is there anything else that I need to mention about myself?
No, not necessarily. We're
Okay.
just some questions from the audience. Maybe you can comment on our next question. This one is from Kushbu. Some of the people had mentioned the coursework, and there's some interest in knowing how intensive the program or coursework has been, and maybe a little bit about how you might handle both the coursework and some of these outside interests that you have in general.
Yeah, so with the coursework, it is kind of intensive. Just for me personally, I do not come from a public health background. I actually come from an animal science background. So a lot of the courses were very new information being presented to me. But what helped me out the most was just putting everything into my Google Calendar. And then there's also like a task option in Calendar as well, where you can set when your assignments are due, and it'll give you a notification of like 24 hours beforehand that an assignment is coming up. But then also on that day, so you can see all your classes, you can see which days and which time that your assignments are due. So that really helped me out a lot. And then throughout my second year, I'm actually a GSI. So that was another thing on top of my courses and extracurricular activities. But I would still recommend the same thing, just putting everything into a calendar, having your tasks and assignments that you need to complete on the same calendar so that you can see everything in one screen.
Great, that's great, thank you. Sumita or Kaylee, Shannon, do you have any commentary on sort of the course load and handling that and your other activities that you're obviously really involved in?
I'll just say you'll be fine. It's it's not as scary as it sounds. The coursework, you know, you have to study, you have to do your work, you have to apply yourself, but it's not as intensive as a lot of people think it's going to be. That's kind of like what I was saying before. And I am the kind of person that says I'm a yes person. Like I say yes to everything. I swear, like sometimes I have like 12 jobs or like 4 groups that I need to go and do something with. And I've been able to manage. So, I mean, as long as you have developed good time management skills or, you know, are still working on time management, you'll be fine with the coursework and doing activities that you like to do and spending time with people and things like that.
Great, thank you. I noticed that Daisy had touched on the fact that she had an animal science background coming in, and there was actually a question from Audrey that says, I'm wondering if anybody from an academic background that wasn't specifically EPID, how have they done and how has that influenced your experience at SPH? And so I think Daisy commented on that. Do others have a comment on where they came from and how that affected their experience here?
Yeah, so I had a science background. I majored in chemistry in undergrad, but I have a no public health background, no epi classes for sure. I chose epi because I wanted to go into research for public health. I really had no idea what I was getting into. The first semester was a steep learning curve for me. The classes were difficult, but yeah, like Kaylee said, like your time management skills really come in handy. You really have to prioritize your school and whatever free time you have, just honestly do what makes you happy. It really will help with mental health. And the courses, especially first semester, are designed to teach you just the basics. So you can have no background in epi and still do really well and learn, because they start from scratch. They don't expect you to know any of the basic stuff of epidemiology. So the terminology might be a little hard for you to just get a hold of, but the professors are really helpful. Your study groups will be really helpful. And just, for me, it's repetition, really helps me just learning things. So if that's your style, then that will work. But it's like learning anything new. You'll be fine, and by second semester you'll be used to how things go and how the methods of epi and bias. It's scary the first month, but then once you get a hold of it, you're okay.
Great. We have just a few more minutes before we go into our breakout rooms, and so I know we haven't answered all of the questions that the students had asked, but when you go into your breakout room, you'll also have access to a faculty member in your track and potentially another current student, so you can get all of the rest of your questions answered there. But before we leave the student panel, I want to ask this really important question from Claire. She says, oh, if everybody could mute, you're not talking. Oh, thanks. Others? Okay, thanks. This really important question from Claire. She says, I'm from Orlando, Florida, and I'm visiting Ann Arbor next weekend for the first time. do you have any recommendations of where I should visit while I'm there? So any, you know, special hangouts or places that you know are open now. What do you like to do when you can get outside of your house here in Ann Arbor?
Eat all of the food. Just go to every restaurant, eat all the food, all the ice cream. The food is amazing. I love to just go and like walk downtown and just try out different restaurants, go into different shops, and that way you can kind of see campus too. So that would be like my recommendation.
Others?
You're from Orlando, so it still might be chilly for you here, but for us it's getting warmer and it's super nice. So we have this we have an arboretum that's open. It's amazing. It's hilly. If you love nature, it's like the perfect place to go for a walk. So I guess just bring a sweater because Michigan weather changes like hourly.
Samita, I was going to make the same recommendation. The Arb and the Botanical Gardens here in Ann Arbor are fantastic. And, you know, with COVID and the restrictions, it's a great outdoor space.
Anyone else, Daisy or Shannon? Okay.
Basically just echoing what everyone else has said. There's been a lot of good food here, a lot of places to get outside and walk. If you like tacos, there's this place called La Taqueria that I enjoy going to. And their chips and guac are top tier.
There's also some comments in the chat about Washtenaw Dairy Donuts. That's a good one. Detroit Filling Station. And Zingerman's is sort of the Ann Arbor classic. If you want like a sandwich, you should definitely check it out. So thank you very much to all of our current students for the panel. At this time, I think we're going to now transition into our breakout rooms. And so you'll be in a room with some of the new admitted students, maybe anywhere from just a few to up to maybe 10 admitted students. And then you'll have a faculty member from your track. And we also are putting current students as available into those rooms. So Elvira and Nancy, did you want to say anything before we do that?
I want to say thank you all so much for your time. I hope you do get to take advantage of the breakout rooms. And if you have any questions at all, please feel free to reach out to us. Just know that you all reach out to us at once. It may take us a little bit to get back with you, but we will get back to you. All right, so let me go ahead and assign the breakout rooms and open all rooms.